the sternal notch, the clavicle, and the clavicular head of the sternocleidomastoid muscle. The subclavian vein lies posterior to the medial portion of the clavicle. Connective tissue fixes the vein between the first rib and the clavicle, giving it a relatively invariable anatomic position. Note that the subclavian arteries are located posterior to the veins and are separated from them by the anterior scalene muscles. Note also that the lung may extend to the level of the first rib. There are two approaches to subclavian vein cannulation. For the infraclavicular approach, which is the most commonly used, first establish the location of the clavicle. Place the index finger of your non-dominant hand in the sternal notch and your thumb on the mid-clavicle. Needle entry occurs 1 to 2 centimeters inferior to the junction of the proximal and middle thirds of the clavicle. The needle is held 5 to 10 degrees to the coronal plane of the body and is directed towards the sternal notch. For the supraclavicular approach, establish the location of the clavicle and of the sternal and clavicular insertion points of the sternocleidomastoid muscle. Needle entry occurs superior to the clavicle, 1 centimeter lateral to the clavicular head of the muscle. The needle is aimed 10 degrees anterior to the coronal plane of the body and is directed toward the contralateral nipple.